Hello, and welcome to Conversations with Dr. Keena, where we talk about learning, leadership, lifestyle, and everything in between. And I am so excited today to have Dr. Demps with us. She is a highly accomplished professional, and I would just love to hand it over to you. So please introduce yourself to our audience.
Thank you, Dr. Keena. I'm Kat Demps, and I'm a multilingual, multi-certified speech language pathologist. My specialty is physical medicine and rehabilitation of the brain, as well as the swallow gut function. I have multiple certifications that primarily focus on neurodiversity, neurogenic communication disorders that relate to the gut, as well as cognition. I've been in business for 30 years as an independent practitioner. I've had over 10 years of hospital privileges with trauma level 1 centers, and I've also been a part of the nonprofit sector in upstate Manhattan, opening 3 schools for students with traumatic brain injuries that needed transitional services from the New York Department of Education. So I'm here now back in Texas, a full-time caregiver to my parents. My father passed away August of 23. And so my husband and I are caregiving full-time for her. And our multiple businesses focus on the caregiver, not just the rehab aspect of the services, but making sure that the caregiver is taking care of his or her health without sacrificing in the process. So thank you, Dr. Keena, for the warm welcome. And I'm happy to be a part of this interview.
Wow, thank you so much for taking the time to be here. And as I said to you all, she is clearly highly accomplished and doing some very important work. And one of the reasons I wanted to speak with you and have you on this platform is because your background and your experience is so dynamic, and it differs a bit from the traditional speech language pathologist. So I understand your academic journey includes a master's in linguistics, a doctorate in public health, among many other certifications. And I'm wondering, what inspired you to pursue some of these degrees that may not be your first thought for speech language pathology? And how have they influenced your approach to speech language pathology and entrepreneurship?
Thank you, Dr. Keena. That's a great question. And I think it was a combination of what the current market was offering in speech language pathology, or communication sciences and disorders is what it was called when I was coming through. There was this notion that it made perfect sense to be as specialized and niched within the field of what I'll call CSD. But I felt like, number one, if I wanted to work with cultures and languages outside of my birth history, I needed to diversify. I needed to find partner fields that would complement what my ultimate goal was, and that was population-based, multicultural, multilingual services. The other 50% of my career path has been because of personal issues, solutions-driven methodologies within my family structure. So my late great-grandmother, my late grandmother, now my late father, those were all opportunities, and as well as my mother, who's a traumatic brain injury survivor, those were issues, situations I was placed in as their power of attorney, medical power of attorney, to help facilitate the best care possible. And instead of just taking, peer-reviewed resources and saying, oh, well, this is what the research says, and trying to collaborate with the providers, I did that, but I also took the time to get a certification. So a lot of my certifications, as I stated earlier, vital STEM, cognitive rehabilitation, culinary nutrition. I'm working on my certification in culinary medicine through the American Academy of Culinary Medicine. It's all kind of been driven by problems that I've faced, whether professionally or personally, and just really trying to be solutions oriented and holistic in my approach, but not too broad, right? Because if you get too broad, then you become more of a generalist. And so I specialized in certain things over the years, over the decades, to ensure that I was not just getting the Cliff Notes version of a disorder, but also understanding the nuts and bolts and being able to speak intelligently about a situation or provide a solution.
Wow. Thank you so much for sharing all of that background. And I think it's really impressive how you've managed to take your experiences and weave them together in such a meaningful and powerful way. And I'm curious, when you entered the field of communicative sciences and disorders, did you intend to pursue entrepreneurship from the start, or is it something that kind of just emerged?
Yes, Dr. Keena, I always knew that at some point I would not be a day-to-day clinician nor a school-based provider, because I've had the honor and privilege of working in every setting, from being an entry-level speech pathologist with a Medicare and Medicaid certified home health facility, outpatient, assisted living, hospitals, clinics, and of course, virtual. Once virtual became accepted within each state that I was licensed in. And so I always knew I had a shelf life for administrative, working with other organizations versus being more interprofessionally collaborative through the businesses that my husband and I currently run. And that stemmed, because I have a feeling next question is going to be why. That stemmed from, number one, the profession yielding itself to that, right? We have the ability to do that. We can work full time and then have a side hustle, is what some people call it. I call it an alternative career change to complement your long-term goal. Let's say you got married, you want to have kids, you want to be able to follow your child's educational planning and not, be stuck on call working for the hospitals like I did for 10 years. I was working like 70 hours a week. But now that I'm married, we have our own businesses, we set our own pace, and it's a blessing. But I must say my experience came from the fact that I grew up in a serial entrepreneurial family. So my family, my parents, my brother, we've always had a family business. And so that foundation had kind of already been set for me.
I think that's a great point. And I completely agree. That's one of the benefits of this field, that there are so many different paths that you can choose, and you don't have to dive into full-time entrepreneurship right away. You can build a clientele or a private practice on the side. And even for audiology, because I know there may be some audiologists out there, it's not exactly the same, but there is some flexibility, and there are some different entrepreneurial paths that you may be able to take alongside your 9 to 5, so they say, or as they say. But that is amazing. And so if I understand, I know you said you are multilingual and you've done some international practice as well. Can you tell us a little bit about that and your languages and what countries that you've practiced in?
Oh, wow. So I know we only have 30 minutes. My goal is to give the highlights, and you can always get in touch with me on the address that's listed on my name block here in StreamYard production. So to answer your first question, I took 3 years in high school. I knew I wanted to be bilingual in Spanish because I'm from the state of Texas, and I knew that there was a necessity for service provision. And this was before the standardized test that Pearson pushed out, like the preschool language scale. It's now 5 English and Spanish. This is when the PLS was not, it was only normed on monolingual English speaking pediatrics. So for me, I knew that I needed to be multilingual if I wanted to work with other populations, but I also knew that language was not enough. There was a cultural component, especially towards disability, that I needed to be competent in. And so once I finished my bachelor's at TCU, Texas Christian University, I partnered with their affiliate university in Mexico, and I did one semester in an immersion program, and the last 2 semesters, a full year, just directly enrolling in their psychology courses, because I had a double major and a minor. And that's what fueled me to broaden my understanding of not only Spanish, but the culture, the signed language component of different countries from Mexico to Brazil. I traveled to over 13 countries during my post-clinical fellowship to kind of gain, through a Texas independent study, an understanding of the culture and the language as it relates to our field. And interviewing those healthcare professionals in our field, respective, because not every country has a speech pathologist, but neighboring professions, to kind of get a better understanding of the types of services those culturally and linguistically diverse families would be expecting if they were to come to the US. And so I've had the opportunity to practice in Mexico, Brazil, but I've traveled to over 45 countries, and I would say about half of them I've gone and I've presented research. So it hasn't always been private practice or providing service provision. It has been more development and training of the staff through nationally approved continuing education courses, as well as the clinical research that I became heavily involved in once I got my clinical fellowship year taken care
of. Okay. Wow. And so the research that you were involved in, is that related to your studies in public health, or what? Or
Great
is that
question.
like a different?
Exactly. Great question. So it was both. When I finished my bachelor's at Texas Christian University, I finished my last 2 years with a Ronald McNair program. And that's where a lot of my oral rehabilitation and interest in multicultural, multilingual services came into play. Dr. Joan Klinken-Aker was my advisor. And so again, back then there weren't any norm tests. And so I kind of niched more in the oral rehabilitation world. And then I moved more towards, okay, how do you distinguish language diversity from difference, knowing that these standardized tests are not normed? And then once I finished my second master's from UT Austin in sociolinguistics, I was looking more at linguistics of sign languages and how to provide services to those families. But then once I finished my public health degree, I had kind of broadened my horizon into more population-based research. So I'm published in cardiovascular research, HIV/AIDS. I did a little bit of oncology, but my niche now is self-care, caregiver wellness, and motivational interviewing, which stems from my dissertation, which focused on motivational interviewing as a form of patient adherence and compliance for chronic health conditions such as cardiovascular disease or obesity.
Oh, wow. So, wow, very diverse experiences in research. And it's interesting how you've been able to niche down into something that really does kind of tie in and integrate well into the work that you're doing now with caregivers. I can imagine that is very needed. And so for that work, is it mainly local in-person services, or can people contact you, or do you provide virtual support to people all over the country? How does that work? Because I know that there are some licensure issues with speech language pathology where you have to be licensed in states. Would you consider that to be a part of what you do as a clinician, or is it separate? And I realize this is becoming a big question, but I'm really interested in knowing more about how you how you integrate that into your practice.
That's a great question, because when you get on Dr. Kat Demp's website, it is the hub, the motherboard for the other businesses that my husband and I manage. And so when you look at drkatdemps.com, that focuses on rehabilitative services for pediatrics and geriatrics. And it does have more of a focus on, speech therapy if your child has feeding or swallowing. But I would say the population niche that I'm very much so integrated with internationally is autism. I'm an international advisor for the International Association of Logopediatrics and Phoniatrics. And so I provide, through our publications and through presentations, a lot of international communities can look to our organization for information on how to integrate their the community with autism into their workforce. And I was privileged to start a curriculum locally, because you asked if I did it international locally. I developed a curriculum for high school students with autism transitioning into college or a career, so that they can be prepared for the workforce, whether they're going to school and they need modifications, or they're applying for a job and they want to be successful. Now, for the other aspects of, say, supervision, when I used to contract out to other states, I would be licensed and I would oversee that assistant or that clinical fellow through their program. I'm licensed in 10 states now. So until the states decide to work in their advantage financially and for the provider, efficiency wise, a grandfathering license, I have to hold those licenses to provide services and bill for them. But if I'm taking care of the caregiver, which is KLD consulting, then that's not a billable service. That is something that's completely at the discretion of the caregiver. And even if the caregiver is receiving billable services from our business, K&K Services, if there's a situation where they can't afford it, Dr. Love's Healthcare is a 501c3. We provide a plethora of coaches that can give them the services that they may not have access through their primary care provider, or maybe they can't find it on our free resource base hub that they can just log on to and access the services that they need. So it's a conglomerate, and I'm thankful that things panned out the way they did, because I started Dr. Love's Healthcare because I saw the disparity of coordination and continuity of care for a lot of the families leaving the hospital and going home. And so that's how Dr. Love's Healthcare got started. But once ASHA came out with a speech language pathology assistant certification, we as in our board wanted the career professionals to get an opportunity to get coaching, not just the family. So there's the billable part, the non-billable part, and depending on what your need is, you are at liberty to tap into K&K Services, Dr. Love's Healthcare 501c3, the integrative nutrition and lifestyle medicine part, or the caregiver wellness, which is KLD consulting.
Wow. Just the way that you've approached providing care in such a comprehensive way, I feel like that really does reflect the public health focus, or like integrating those public health principles of being a resource, and the fact that you have the 501c3, that is really amazing. And I'm wondering, from that public health perspective, do you feel like that has contributed to your approach to developing a practice in any other ways, or how do you feel like that public health focus influences, maybe differentiates you from other clinicians who may start a business or practice?
Yeah, that's a great question, Dr. Keena, because when you learn about public health ethics, it's not just an oath to preserve life, maintain life. It's a population or systems approach, and it starts with a needs assessment, and then from that needs assessment, driving your plan of care and intervention to address not only a one-on-one need, which is how we're trained in the field of CSD. It's a generalized population health approach. So it's equal and it's equitable healthcare for all. And that's what attracted me to public health in the first place, because I think our field is great at siloing and really honing in on a disorder process and trying to collaborate with the primary care provider and any ancillary services to make sure that patient has the services they need. But when it comes to the bigger picture, so when COVID hits, and you can't conduct therapy at a school because the school is closed down. What are you going to do? Right. And so that's where public health has really helped me diversify my approach to one-on-one as well as population-wide healthcare services.
Wow. Well, thank you. So shifting gears slightly, like you are clearly very accomplished and you have multiple businesses and you are managing clinical practice, research, and entrepreneurship and leadership, which is a job in itself. And so that is a lot. And and how have you found ways to manage all of these different responsibilities? And I know that you do lifestyle lifestyle medicine, so perhaps this is something that you definitely give forethought to. So yeah, but I'm interested in knowing, how do you manage all of that?
Absolutely. I would say it boils down to learning to say the 2-letter word no one likes to hear. No. If you don't learn to say no, you will burn out. You will burn out quickly. I don't care how many millions of dollars you make per year, how much you trust your staff and you're delegating. If you don't learn what your capacity is, when to say no, delegation, automation, it's great. I use it every day because I've already stated how many irons my husband and I have in the fire. But I would say that's the biggest takeaway. If you don't remember anything else from this interview, learn to say N-O and keep the train moving. Yeah.
Yes. And so for students who may be in speech language and hearing sciences now, maybe they're preparing to be a speech language pathologist or perhaps an audiologist or another allied health professional, and they're considering entrepreneurship. What kind of advice might you give to them?
Excellent question. So I'm going to answer that in this interview, and then I'm going to put a plug in. And I have to put a plug in because this is a question that I've been able to monetize, and I know it's important. It was more important post-COVID than pre-COVID. You have to have a plan. You're not going to know what you always want to do, but if you have at least a 1-year plan, a 5-year plan would be nice too. And the way you, sorry, it's fax line. The way you decide on that is you think, this is what my mother would ask adults that would come into her office for career advisement. She would ask, if you could get up every morning and think, oh, wow, I get paid to do this, what would it be? Write it down. What does it look like? What does it look like right now? What are the steps it's going to take for you to get there a year from now, 5 years from now, and ideally 10 years from now? So with that said, I created a continuing education course called Alternative Career Pathways, because at some point in your career, you're going to get that itch to change, whether it's you got married or you had a baby or you have had a death in the family, or there's a public health issue like COVID, or here in Texas, we had Ebola and SARS. You are going to be faced at some point with the need to make a career change. So if that is something that tickles your ears, or you're already there, whether you're an early career or a late career changer, there is a continuing education course that I have done over the last 4 years with CHAO, C-I-A-O, CHAO seminars. And you can pull up the recorded talk. I did a talk last year. We're going to be doing another talk in the fall. And that can guide you step by step on how to develop your career, when you need to change your career, how to update your resume, how to handle interview questions. Because, some of us, we get stuck in our field and we don't really change. And, times have changed. And with AI, I think it's made it even more challenging to be authentic, right? We don't want to be replaced with artificial intelligence. We want to be authentically intelligent in who we are. so that we retain our value. There's nothing wrong with AI, but it's really more a brainstorming tool. It cannot replace who I am or who you are, or how our hands can touch our patients and clients and change their lives.
Absolutely. And thank you so much for sharing about that amazing resource. And it's so needed because I, as a clinician, and I'm duly certified as a speech language pathologist and audiologist, but it is really easy to get caught up in this idea of I've been trained to do this one thing. So what else could I potentially do with my skill set? But honestly, we learn a lot in this field, and we have a lot of transferable skills. So I'm sure you are going to be an amazing resource for a lot of different people. And so looking at the time, we're coming up on the end. If people want to find you and reach out to you, I know you've directed them to your website. Are there any other places where they should look for information or on social media, or is that really the hub where you recommend that people go to contact you?
That is the hub, because I've always been coached to be very succinct and brief and to the point. And Dr. Kat Demps is going to be your hub. Once you get on that website, it's going to give you the links to all the other businesses that my husband and I run, as well as the social media outlets. So I think if you connect with us on www.drkatdemps.com, you're going to get all the information you need. And there's a way to actually reach us and set up an appointment for a free consult on our Calendly app. So look forward to hearing from you all.
Yes. Okay. Well, I think that we will go ahead and wrap it up there. But I just want to say thank you so much for taking the time to share all of your wisdom and these gems. And I am sure that, well, I know I got a lot I took away a lot from it, and I'm sure that the people watching definitely did as well. And I truly encourage you all to reach out to her. You can see that she is a wealth of knowledge, and she has many different services that you may benefit from. And if not, then maybe refer. You may know some people who could potentially benefit from some of the services she's offering. So definitely visit that website. And thank you all so much for tuning in. And I will look forward to seeing you next time. Thanks.
Thank you.